All participants, please continue to stand by. The conference will begin momentarily. Once again, please continue to stand by, and thank you for your patience.
Hello everyone. Bon vendredi tout le monde. Ce matin, je veux parler.
This morning, I want to talk about the third wave and the measures that we're continuing to take to protect you. Let's start with the topic of travel.
Rise in COVID-19 cases in certain parts of the world, as well as the emergence of more variants of concern. So yesterday, we announced new and even stronger travel measures. Since last night, all passenger flights coming into Canada from India and Pakistan are suspended for 30 days. Now, we know that it's not only about direct flights to Canada. That's why there will also be additional measures for passengers departing from India or Pakistan who come to Canada via indirect routes. These passengers will need to obtain a negative COVID-19 pre-departure test from the last country they traveled through before arriving in Canada. Just like when we suspended flights from the UK last December for similar reasons, our government will continue to do whatever it takes to keep Canadians safe. Ces restrictions s'ajoutent.
These restrictions have been added to prolonging till May 21st of other measures already in place. These include tests before and after arriving in the country, a strict quarantine, and a quarantine in the hotel at the traveler's expense for those who are arriving. So these are compulsory and are amongst the strictest in the world. Those who do not respect them will face severe consequences.
Talk about the situation with the third wave here at home. As you may have seen, Dr. Tam presented new modeling projections earlier today. Across the country, the number of daily new cases has more than doubled in the past month. Hospitalizations have also increased and are still increasing. And there are more contagious and more dangerous variants out there. The situation is critical, but we can and we will beat back this third wave. What we have to do is clear. We need to stay home and avoid in-person contacts. And if you absolutely need to go out, in other words, for essential reasons, continue to follow public health guidelines. While we work around the clock to vaccinate as many Canadians as possible, as quickly as possible, we all have to keep practicing physical distancing. I understand that there's a lot of COVID fatigue right now. We all feel it. But the more we reduce our contacts, the faster we will end this third wave. I know it's not easy, but remember, this is not forever. We just need to hang in a little while longer. We need to protect our loved ones and essential workers. And if we do what we know we can do together, we will get through this. So far, we've delivered almost 14 million vaccine doses across the country. 30% of eligible adults in Canada have received at least one vaccine. Next week, we'll get almost 2 million doses, including our first 300,000 doses from Johnson & Johnson. Vaccine doses continue to be the good news we all need in what has been a very tough spring. While more and more Canadians are getting vaccinated right now, it's also important to plan ahead for the future. We've reached an agreement with Pfizer for 35 million booster doses for next year and 30 million in the year after. This deal includes options to add 30 million doses in both 2022 and 2023, and an option for 60 million doses in 2024. Pfizer has been a solid partner for Canada in this fight against COVID-19, and we're happy to be one of the first countries to secure an agreement with them going forward. These boosters will be the latest version of the Pfizer vaccine based on research and testing, and they will help us keep the virus under control. And the work doesn't end there either. We're on ongoing discussions with other vaccine manufacturers about their plans for booster shots too. Pour maintenant et pour l'avenir.
For now and for the future, it's important to continue to strengthen our capacity for developing and producing vaccines here in Canada. To that end, I'd like to congratulate the Medicago company in Quebec, which is now the first Canadian company to have submitted its candidate vaccination against COVID-19 to Health Canada. This demonstrates that we do have talent and knowledge and expertise here in Canada, and that our government will always be there to encourage scientists and experts here. Before concluding the topic of vaccines, I'm happy to share that Sophia and I will be receiving our first vaccine doses this afternoon. Given that Ontario has invited people aged 40 and more to receive the AstraZeneca vaccine in drugstores, it's now our turn. We're looking forward to this. We're relieved to know that this simple gesture helps us protect ourselves, but especially to protect those loved ones around us. So if it's your turn, I invite you to make an appointment as soon as possible. If we all do our part, we will overcome this virus.
First dose of AstraZeneca this afternoon at the pharmacy just around the corner from here. So if you're eligible for your vaccine like we are, make sure you get your dose as soon as possible. Our role as government is to keep Canadians safe. We're ready to do whatever it takes to get this third wave under control in Ontario, in Alberta, and everywhere else in the country. On that front, today, I have some updates to share. Stopping the virus from spreading is key. Since March, we've sent over 400,000 rapid tests to Ontario alone, and we're in the process of sending hundreds of thousands more. We're working with the Ontario government, the Red Cross, and pharmacies to distribute more rapid tests while making it easier for businesses to access them. We've also delivered medical equipment like oxygen units and ordered more therapeutics. And while we do all this, we're working with the Ontario government to send support to their frontline workers as soon as possible. We've identified up to 100 healthcare professionals, like ICU nurses and doctors, who can be deployed rapidly from federal departments to places they're needed most, including the GTA. This is the moment to all work together. Newfoundland and Labrador has offered healthcare resources and identified teams ready to go as early as next week. Other provinces and territories are looking what they can deploy too. We're ready to provide transport support and funding to enable them to help out where needed in Ontario. In fact, we've set aside $80 million in emergency funding to support the costs of these efforts. To frontline workers in Ontario, in Alberta, and across Canada, you are doing an incredibly important but hard job right now, and we're here to help. And to everyone who's stepped up to help their fellow Canadians, well, that's just who Canadians are. We're there for each other in times of difficulty, but thank you for showing the way. The only way to beat this virus is by working together as a team, so thank you all for doing your part. Cette semaine,
This week, with the 2021 budget, we presented our plan to end our fight against COVID and to help Canadians to recover from this crisis. We want to make sure that all Canadians have access to good jobs, that mothers and families have access to affordable childcare services, and that the most vulnerable people get more support. We want to build a safer and healthier Canada for everyone. That's why we're increasing our climate ambitions. Yesterday and this morning, I participated at the Leaders Summit on Climate, organized by President Biden. I shared there our new climate target for 2030, which will be 40 or to 45% below 2005 emissions. I also mentioned our investments in public transport and eco-energetic renovation.
U.S. Climate Summit, Canada is raising our ambition once again on climate action. The strengthened climate plan we presented last December, along with our new Budget 2021 investments, will allow us to build a cleaner future and create good middle-class jobs. Merci tout le monde.
Thank you, everyone. Thank you. I'm happy to pass the floor to Minister Blair. Bill?
Prime Minister, I'd like to begin my remarks by just reminding Canadians that we are strongly advising against all travel. Now is not the time for taking trips abroad to other countries or even for traveling across Canada. As much as possible, we need Canadians to stay home, and we need them to continue to follow the public health guidelines, which are our most effective response to keep Canadians safe. Yesterday, we introduced some new measures, and I want to simply, I'd like to begin, if I may, by briefly reminding Canadians about what we have already put in place at our borders. You've heard us say a number of times, we have some of the most strongest measures anywhere in the world, and I'd like to take the opportunity to quickly remind you of what those are. More than a year ago, we banned all non-essential travel from abroad by land and by air for all non-essential travelers, and we took the extraordinary and unprecedented action of closing our border with the United States for non-essential travel. We imposed a mandatory 14-day quarantine period on all returning travelers. And we have also introduced pre-board and pre-arrival negative tests, so people have to present a negative test upon their arrival or even before they get on a plane to fly to Canada. We test them again upon arrival. We've been doing genome sequencing to identify variants if people do come to this country and are infected with COVID. We've also implemented post-arrival testing at day 10. For all international destinations, we've also implemented a 3-day requirement of government accommodation for quarantine. And we're following up on our quarantine orders by phone and by visits to ensure compliance, and there has been, where required, enforcement for those who choose not to follow our rules. I think it's important to point out that the majority of international travels are actually Canadian citizens returning from abroad. They wish to return home, and they have a right to return home. And our job from the outset of the pandemic is to ensure that we effectively manage their return so that they can do so safely and not represent a risk to other Canadians. And I want to advise you, these measures have been working. Since the implementation of these extraordinary measures, we've seen total travel numbers of people coming from international destinations to Canada is down by over 88% from the previous year. Cases related to close contact with a traveler account for only 0.7% of positive cases in Canada, and cases related to travel of an individual for themselves is less than 1%. We have demonstrated that we will always do what is necessary to keep our communities safe from COVID. We have, in those decisions, relied on the evidence and the advice provided by our public health officials. Yesterday, we built upon the border measures that we have in place by stopping all flights from India and Pakistan. The device that we use for that is what is referred to as a notice to airmen that essentially stops all direct flights. But we also know that the risk would persist if we allowed people to travel in connecting flights through transiting countries. And so we are among the only countries in the world that are also taking action to actually disrupt and break that travel journey, to require people to actually land, comply with all the restrictions and prohibitions that may exist in the transiting country, to get another COVID test in that country to prove that they are negative before continuing on in their journey to Canada. These measures will be in place for 30 days and they'll be reassessed at that time. But we believe these are the right measures. In addition, at all of our land and airports, we're going to ensure that at our passenger information kiosks, travelers will be questioned about their recent travel to hotspot countries, including, of course, India and Pakistan, and those individuals who may have been in those countries in the previous 2 weeks will also be subject to enhanced screening by our public health officials to ensure that they are safe to enter Canada. Since the beginning of the pandemic, we have and we continue to take strong measures to secure our borders, to slow down the spread of COVID. And I believe we have demonstrated our resolve and willingness to add additional layers when that is warranted. Finally, I'd like to just remind Canadians, if you are traveling, it is your responsibility to understand and to follow all of the rules that have been put in place. And you can find detailed information at the Canada.ca website. I'd also like to take the opportunity, if I may, to thank our border service officers and our public health officials who are doing extraordinary work on behalf of all Canadians to secure our border and to protect our health. Thank you very much. And I'll now, if I may, turn over to Minister Anand.
Thanks so much, Bill, and good afternoon, everyone. I'm very pleased to be here with you today. I would like to provide you with an overview of two important aspects of procurement as it relates to ensuring that our government sees Canadians through this pandemic. I will first speak to PPE, and then I will provide an update on our vaccine procurements. Over the last year, the federal government has secured contracts for more than 2.7 billion articles of personal protective equipment and other medical supplies. The vast majority of this vital PPE has been provided to support provincial and territorial frontline healthcare workers already. As
of now, more than 1.5 billion articles have been delivered, and 40% of all the contracts were concluded with Canadian suppliers. These include 2 long-term contracts for tens of millions of made-in-Canada N95 respirators made by Medicom in Montreal and 3M's plant in Brockville, Ontario.
Same time as our government 24/7 to ensure that the immediate needs of frontline healthcare workers were addressed, we were also looking to the future and taking into account long-term needs. Our contracts are indeed long-term in nature to ensure that we had and will have supplies needed for a possible second or third wave and ongoing into the future. The same is true with vaccines. As millions of vaccine doses continue to arrive every week into Canada and are administered at an ever-increasing rate, our government is also looking to what comes next. What about next year's doses and the year after that? Comme le Premier ministre vient de l'annoncer,
as the Prime Minister just announced, the government has entered into an agreement with Pfizer to secure doses of COVID-19 vaccines in 2022 and 2023, with options to extend into 2024. Under this agreement, the Government of Canada will have guaranteed access to 65 million doses of Pfizer's vaccine over the following 2 years, with access to up to 120 million more if all options are exercised.
To be guided by science and expert advice so that we can effectively meet future challenges head on. As such, this agreement with Pfizer will provide us with the flexibility to procure booster shots as well as new vaccine formulations to protect against variants of concern and vaccines developed for younger populations. This is a very positive development for all Canadians. Lastly, I would like to provide a quick overview as to where we are as a country with respect to current vaccine deliveries. To date, 13.7 million doses of vaccine have arrived in Canada, and we are within the top 3 among G20 countries in terms of total doses administered to date, average doses administered daily, and percentage of population with at least 1 dose. 27% of Canadians have had at least 1 dose of vaccine.
Over the course of the coming week, we anticipate receiving approximately 1.9 million doses. This represents 1 million doses of Pfizer vaccine arriving early in the week, 650,000 from Moderna midweek, 300,000 Johnson & Johnson doses arriving towards the end of next week, with distribution to provinces and territories beginning the following week.
I want to say that my husband, my sisters, and my father have all received their first doses of vaccine. I'm now registered here in Oakville, Ontario for my shot, and I very much look forward to getting that call to come in and receive it. We will continue as a government to bring vaccines into this country by the millions. It has been a very long year, and that light at the end of the tunnel is getting brighter and closer every day. Thank you. Merci. Miigwech.
Merci, Madame la Ministre.
Thank you, Madam Minister. The Prime Minister is ready to answer questions for 20 minutes, starting at the phone. One question, one follow-up question.
For 20 minutes, one question, one follow-up, starting with the phone. Opérateur, c'est à vous.
Operator, the floor is yours.
Keeping your turn from iPolitics, please go ahead.
Hello, everyone. My questions are for Prime Minister Trudeau and Procurement Minister Anand. Emails from staff in the Prime Minister's office that were made public last week show that Canada paid more than twice what some of its allies did for AstraZeneca's vaccine. Canada has not received regular shipments of this vaccine yet when it's being used widely in countries around the world. I'm wondering, what benefit did Canada get for paying a higher price for AstraZeneca's vaccine, or were we simply out-negotiated?
From the very beginning, Charlie, we were focused on getting as many doses as possible, as quickly as possible, from as broad a range of different potential vaccine producers as possible. That's why we ended up with a wider portfolio of potential vaccines than most of our peer countries, and a total number of doses that is higher per capita than any other country. Obviously, we've continued to work closely with those companies to get more vaccine doses in quicker, but we also recognize that the more we can get vaccine doses quicker, the quicker we're able to get through this, and the better it is for our economy. And that is what drove us in all of our discussions and negotiations: the protection of Canadians and a quick restoration of economic normality. But for more details, I'm happy to pass over to Minister Anand.
Thank you so much, Prime Minister. We aren't able to disclose the price per unit for doses at this time in order to protect Canada's supply of vaccines. But as has been previously stated, we have negotiated very aggressively to conclude our contracts and to accelerate doses to Canada. And our government will stop at nothing to ensure that the health and safety of Canadians is protected. And that is why we put in place a diversified vaccine portfolio with 7 leading vaccine suppliers on the basis of the scientific and expert advice provided by the Vaccine Task Force and the Public Health Agency of Canada. It is very important to remember that AstraZeneca is but one of 4 approved suppliers, and by the end of next week, we will have all 4 approved suppliers having vaccines delivered in this country. And the benefits of this diversified portfolio for the health and safety of Canadians goes right back to last August when we were negotiating our contracts, where we were very aggressive in terms of making sure we had sufficient vaccines for Canadians. And the 48 to 50 million vaccines that will be here in this country prior to the end of June is testament to that aggressive strategy that we have consistently produced and brought to the table. And I will add that we have accelerated 28 million doses under all of our contracts to earlier quarters. Again, our objective all the way through is protecting Canadians, and our consistent supply of millions of vaccines, placing us in the top 3 of G20 countries, is testament to that strategy. Thank you.
Thank you. Following up.
Okay, thank you. I appreciate those points about sort of the larger strategy, but I would like, along with answering my follow-up, if you can sort of touch on what exactly we're getting out of paying $8 for the vaccine that other countries have bought for $4. But moving on from that, President Biden said earlier this week that he's planning to send some more vaccines to Canada in the future, but stopped short of saying when exactly he would do that. Right now, with much of the country locked down and our vaccine rollout not operating at its max capacity, this would be a major assist. But as soon as the month's time, according to your government's projections, Canada will be receiving close to the 3.1 million doses per week that the provinces and territories have said they're capable of administering in that same time frame. So I'm wondering, will you tell us what you're doing to secure these vaccines from the U.S. soon before it becomes more of a hollow offer?
First of all, we were very pleased that the U.S. was able to send us 1.5 million vaccines a number of weeks ago. We continue to work very closely with them, our closest neighbor, to ensure that we're getting more doses as quickly as possible. Those conversations, as always, will continue. Anita, anything to add?
Most definitely. First of all, your follow-up on the AstraZeneca pricing. AstraZeneca has been clear that it is offering not-for-profit pricing across the board. The prices differ across jurisdictions based on the other considerations that need to be taken into account, including domestic manufacturing capacity. Moving on to your second question relating to the United States, as the Prime Minister said, it was because of this very strong relationship that we were able to secure the exchange agreement for 1.5 million doses of AstraZeneca. We are continuing to negotiate on that basis with the United States in terms of the possibility of additional doses crossing this border. We are engaging at all levels, as the Prime Minister's call with President Biden suggests, and I too am in constant communication with Jeffrey Zients and his team in the United States. We should always remember that our portfolio of 7 contracts provides us with a basis for undertaking these negotiations. So the fact that we had the contract with AstraZeneca, for example, allows us to do the exchange agreement where we are drawing down on the 20 million doses that we have procured from AstraZeneca. We don't have additional details to share at this time, but we will provide information as soon as we receive it. We are pushing very hard to receive more and more doses from all suppliers and areas as soon as possible. Thank you.
Merci. Opérateur, prochaine question au téléphone.
Thank you, operator. Next question. The next question is from Mélanie Marquis, La Presse. You have the floor. Yes, good morning, Mr. Trudeau. We saw your photo yesterday on one of the Quebec tabloids, the front page, to illustrate the arrival of the Indian variant. That headline was condemned by the political class, including by Pablo Rodriguez. What did you think of that? First of all, I'm not taking it personally. It's not of concern at a personal level, but what I find to have been an error of judgment was to feed an intolerance that we're seeing, unfortunately, towards Canadians of Asian origin, and that can be extended to the Indo-Canadian community. I think it's really a time to get closer to each other, to understand that we're all in the same boat and we're going through this together. And everything that creates opportunities for stereotyping or for increasing intolerance should be avoided during this crisis, and actually in normal times as well.
I don't take tabloid covers personally. That's not what's at issue here, but I think it was a grave error in judgment to feed into some of the unfortunate intolerance and stereotypes that we've seen over the past number of months on the rise. The rise in anti-Asian racism and intolerance across the country. We certainly wouldn't want to see further encouragements to intolerance of Canadians based on what's happening in other parts of the world. This is a moment for us to pull together, to be there for each other. It's not a moment to sow division.
En suivi, Mélanie?
Follow-up, Melanie? Yes. To continue in the same vein, Mr. Trudeau, maybe it's question of ethics or philosophy, but are you comfortable with the use of the terminology Indian variant? So we would say, the British variant, that was okay. But now we're asking ourselves about the Indian variant and the connotations that might have. What do you think of that? Well, first of all, I believe that we should follow the recommendations of experts and scientists who emphasize the fact that a variant was discovered or documented in one place is not necessarily the place of origin of the variant. That's why we no longer talk about the British variant or the Brazilian variant. We talk of the P1, B1, the various code names of the variants. So the fact to localize or stigmatize a country or group of people is a bad idea. And so we should try and use the respectful nomenclature, which would be a priority for me. Thank you. Operator, final question at the phone. Thank you.
From Marika Walsh from the Globe and Mail. Please go ahead.
Hi, Mr. Trudeau. Thank you so much for taking our questions today. I'd like to return to the testimony that Canadians heard from committee last night. How do you explain to the women in the Canadian forces that your Defence Minister, Harjit still is in the position he's in as Defence Minister and has not been held accountable for what has played out in the last 3 months?
I think, first of all, that was extraordinarily moving testimony last night from a woman who demonstrated both her strength and her commitment to bringing about change. We know that the Canadian Armed Forces need to change. We know that the culture of tolerance around unacceptable actions or harassment needs to end, not just for those who choose to serve in the Canadian Armed Forces, but in anywhere, any workplace across this country. That's why over the past years we have taken significant steps, but why we also know there is much more to do. I can tell you that we continue to work very hard and closely with various organizations to move forward in the right way, and we will have more to say shortly.
Following up, Marika?
And do you regret keeping General Vance in the position, extending his position and giving him a raise, given what we've heard?
Obviously, looking at this whole situation, we need to make sure that we are creating better support systems and better processes to ensure that there is proper accountability, there is proper transparency, and that anyone who comes forward with allegations or concerns is getting the resources, the process, and the support necessary to be able to actually have those concerns move forward through a responsible and transparent process. Those are things that we are continuing to work on. We know that there's improvements that need to be made.
Thank you. I'll now take questions in the room.
David Aiken, Global News. Prime Minister, good morning. I'd like to continue on that topic. Your government has described itself as a feminist government. And many times you might have walked that walk, but on this issue, sexual misconduct in the forces, we're hearing complaints and concerns over and over again from women in the forces that on this front you're not living up to that moniker. That accountability has to happen here, and it has to happen with the civilian who is supposed to be in charge, and that's Minister Sajjan. And it's inexplicable to many why he has not been asked to step aside.
First of all, we have taken seriously the responsibility of fighting against sexual harassment, sexual assault in institutions and in workplaces across the country from the very beginning when we first took office. We have made significant improvements to processes and systems, including within the armed forces, but we obviously see very clearly there is much more to do. As it is, as we've highlighted a number of times, the Minister of Defense, when he was made aware that there were allegations against Chief Vance, he made sure that there was a proper process to receive those allegations, that it is not the place of a politician to investigate directly, but that those allegations need to be taken seriously and followed up on, and that is the process that was followed. There are, of course, lots of things we need to add to and create better processes for, but that is something we continue to work on.
And just to follow up again in that area, Major Brennan's testimony yesterday introduced perhaps a new disturbing element of this, in that she testified that General Vance thought he was, quote, untouchable, and that he, quote, had the civilian person in charge of the forces, the defense minister, quote, under his control. Do the civilians control the armed forces? And when will you appoint a civilian to be in charge of investigating sexual misconduct, having authority to do so, call witnesses, to put the civilians in charge of the guys and women in uniform?
Obviously, the measures that have been in place and that have been put in place over the past few years to change the culture of the armed forces, to ensure proper support for anyone who chooses to serve and is faced with difficult or impossible situations. We take this extraordinarily seriously. We are working with various partners and looking very much at what more we will do in terms of getting it right. We will be making further announcements in the coming weeks.
Hi, Prime Minister. Tom Perry with CBC. I'd like to ask you, in the short term, you've put this suspension of flights from Pakistan and India. Looking ahead, variants are everywhere. So I'm wondering, are you looking at other countries? What criteria will you use when determining if there are other measures? And can I ask you, looking further ahead, you're announcing orders today for vaccines for boosters going out to 2024. So how long do you think it's going to be before Canadians just don't have to worry about COVID anymore?
First of all, on borders, let us remember that Canada already has in place and has since March of 2020, since over a year ago, some of the strongest measures of any of our peer countries around the world. The mandatory 2-week quarantine that has been in place since last year has been extremely effective in preventing mass transmission from outside our borders. At the same time, when variants of concern started to spike, we brought in further measures of a pre-departure test required before anyone could fly home. Further, we brought in arrival tests with a mandated government-approved accommodation stay while the result of that test was processed. And we keep those 2-week quarantine while we also have stepped up on verification and indeed penalties for non-compliance. So that is the base level that is most protecting of Canadians. And we are extremely active and looking always at how we can tighten and strengthen those measures. At the same time, it has been clear over the past couple of weeks that there is a disturbing pattern of a much higher caseload from India and Pakistan than from other countries. And those thresholds were looked at by the Public Health Agency and others, and a determination was made that there needed to be further steps taken, which we've been working on this past week and announced yesterday. But for more details on that, I'll turn to Minister Blair. I just want to also mention that in terms of looking forward to booster shots, I think Canadians expect us to be ready for whatever happens. And there is certainly a hope that booster shots might not be necessary. But we are much better off to ensure that we are prepared in case they are than not prepared, prepared for the necessity rather than not be prepared. I think that's what Canadians have seen clearly as being important in this pandemic. But Bill, I'll turn to you on borders.
Yeah, thanks, Prime Minister. And just I'd like to point out that our decisions are based on evidence and on the advice from PHAC. And one of the reasons we test people prior to boarding the flight and then test them again is to identify those individuals who may have become infected in the ensuing 72 hours. But we're also, as I've mentioned, doing genome sequencing on those who test positive. And that enables the Public Health Agency to identify places of origin where people are coming from countries that may have a higher infection rate. And it also also enables us to identify the possibility of the variants coming into Canada. Based on that analysis and that work that the Public Health Agency has done in that testing, they were able to identify to us that almost 50% of those who were coming to Canada who subsequently tested as positive were actually coming from one point of origin, the country of India. And so based on that evidence and their advice, that's why we took the very necessary and appropriate steps to issue a notice to airmen to stop all direct flights and additional measures to prevent, connecting flights for people coming from that point of origin. And just to be really clear, we also recognize that there are many Canadians who may need to return from India and from abroad in the future. And we want to make sure that we've got all of the necessary protections and assurances in place to ensure that that can be done safely. And that's what all these measures are about. In every case, it's based on evidence. It's based on the testing and analysis and advice that PHAC gives us.
So when people hear that we are buying or signing contracts for booster doses in the coming 3 or 4 years, they might think, oh no, we're going to be stuck with COVID for a long time. That's possible. And I think people want us to be ready so that we can minimize the impact that we may see in a year or two. I know that we all hope to be done with COVID this year and that we no longer need shots against COVID. But if we need them, it would be much better if we were ready with contracts in place and clear terms in terms of delivery. And so we're doing this so that in case of need, we will have them. Jean-Louis Blouin from Radio-Canada. Mr. Trudeau, the delivery of doses to Canada is increasing. I wonder if you're worried about the hesitation to be vaccinated. I know that in the U.S. there's a plateau that's now happening. Are you worried that we may face a plateau situation here in Canada?
Decision about the 100 healthcare personnel that will be sent to Ontario. When do you expect them to arrive, and maybe how many more could be sent to Ontario after that?
First of all, I can say that I'm very happy that I will be able to get my first dose today with Sophie. And we can see throughout the country that our people are registering, lining up for vaccine doses because Canadians understand that the way we can get through these restrictions, through this crisis, is to get vaccinated. So we will continue to encourage, by all means possible, Canadians to get vaccinated. But we did see in the country already that there is a lot of enthusiasm and this sense of responsibility that we're getting vaccinated, yes, for ourselves, but also for our loved ones, for our neighbors, for our frontline workers. It's the responsibility of the citizens to be a part of the solution, and to get vaccinated is a way of doing it.
Sorry, to Minister Blair on the healthcare workers. You're on mute, Bill.
Sorry, Prime Minister. One of the things that I think is really important is that what we have seen right from the outset is that Canadians have been there for each other. We saw a number of the provinces and territories step up when asked for help for their neighbor provinces. And our government is working really hard to facilitate and also to support that. We're looking through our resources at the Canadian Armed Forces, through the Canadian Red Cross, through all our federal agencies to see in ways which we can help. There has been ongoing and continues to be ongoing discussions with the province of Ontario so that we can deliver the help that they need. The timelines are being quickly developed, and it's an all-hands-on-deck Team Canada approach. We have, from the very outset, been there for the province of Ontario. We've received over 21 requests for assistance. That's for long-term care facility support for temporary foreign workers. We provided 2 mobile health units, one in Sunnybrook in Toronto, one in Hamilton. We've established 10 self-voluntary isolation sites that PHAC is running throughout Ontario. And of course, we've been also providing support to over 28 First Nations. In response to requests that we've received from Ontario, we'll continue to be very open to all of their requests, and we stand by ready to help when they need it.
Take 2. Kevin Gallagher, CTV National News. Are there any concerns with the report from the New York Times that doses coming to Canada from the United States with AstraZeneca from the plant in Baltimore that's had concerns about tainted doses. What can you say? I mean, you're getting the shot today, sir. Are you concerned at all? What do you want to tell Canadians that we may be getting tainted doses from the United States?
I am excited and confident about getting my vaccine today. I can highlight that Health Canada is always ensuring that any doses we receive in Canada are safe and effective. We have confirmed that the doses received from Canada, from the United States a number of weeks ago are not have not been subjected to the challenges that have come up currently in the Baltimore plant. There is absolutely no danger of that for Canadians, but I can turn to Minister Anand, who can have further details on that, but there is no reason for anyone to be concerned.
Thanks, Prime Minister. When this issue first came to light, we contacted the supplier and ensured that the supply that was coming to Canada was not affected by the issues that emerged at the plant. And so this is an issue that we were immediately in touch with the supplier about, and the supplier assured us that these issues had not been affected. Thank you.
Stephanie Taylor with the Canadian Press. Mr. Prime Minister, were you surprised at all when U.S. President Joe Biden raised the possibility of sending extra doses of AstraZeneca here? As well, given the unfolding crisis in India, reports that some hospitals in Delhi are running short on oxygen, is Canada planning on sending any supplies, oxygen, PPE, other medical supplies to India to help?
First of all, we are in regular contact with the American administration on collaboration on a broad range of things, including on the fight against COVID-19. And I had spoken earlier that day with President Biden about our situation and how we could continue to work together. So it was not a surprise when he brought it up in the press conference. On procurement and issues around international support, I will turn to Minister Anand.
Thank you so much, Prime Minister. The answer to the question is yes. We are in touch with India and our High Commissioner in India, Nadir Patel, about a number of options that may be on the table for us to assist. We will stand ready with PPE and ventilators and any items that might be useful for the government of India. I, of course, have a very personal connection with that country, but on a broader level, when we see a country in need in that regard, we do stand ready. And as I mentioned in my remarks, Canada has procured 2.7 billion items of PPE, 1.5 billion items have been delivered already. And in that regard, we have PPE that we can assist India and other governments with, and we will continue to be engaged to assist wherever possible. Thank you.
Merci beaucoup. C'est ce qui met fin à la conférence de...
Thank you very much. That concludes today's press conference.